As we all know, everyone wants to get back outside. But getting the vaccine as a shot, not for everyone. And we have a different alternative for you that is both home friendly and an alternative to a shot. My name is Timothy Reeves.
My name is Stoney Swearingen, co-founder of DRAST Delivery.
My name is Darlene Marate from DRAST Deliveries.
My name is Ryan Fowler.
Hello, my name is Alexandra Jackson.
And we are DRAST Delivery, bringing you the next best alternatives to the COVID-19 vaccine to get you vaccinated. Firstly, I'll be bringing to you the storage and delivery requirements of the COVID-19 vaccine. There are two main different types of storages for the vaccine. There is frozen and then there is refrigerated. For refrigerated, those temperatures should ideally be kept between 5 degrees Fahrenheit and negative 58 degrees Fahrenheit. And then for the frozen vaccines, those should be ideally kept at 40 degrees Fahrenheit. These temperatures help to keep the potency of the vaccine. And as per delivery, to the figure you see on the screen in front of you, that follows the delivery procedures that most places follow in delivering and packaging of the COVID-19 vaccines. Next, I would like to pass it off to my co-founder of DRAST Delivery, Alexandra.
I would like to discuss the support of doctors and nurses abroad. Thanks to the World Health Organization for this information, as well as thanks to them for donating PPE supplies to healthcare providers abroad. This really helped assist them in vaccine distribution and in ensuring that the appropriate vaccine was going to the appropriate patient during the COVID-19 battle. Another success story is the SEIRVD model, which is drone delivery. Drone delivery is just delivering vaccines to the appropriate patients by drone in different countries. And very similar to that is the MLIP model, which they just base their delivery on who needs it at the exact timing. So for instance, if someone is more susceptible to getting sick, they base the delivery off of who needs it the most at the time.
Within my topic of choice, I have researched different types of vaccines, such as live attenuated, inactive, mRNA, alternative vaccine delivery methods such as intradermal or edible vaccines, and lastly, difficulties in setting up vaccine requirements such as the government not implementing vaccine mandates.
There are two ways we can use to manage our record keeping, digitally and traditionally. In regards to vaccine delivery to third world countries, a digital method would be more efficient and more organized and quick. Additionally, there's a process to actually manage our records. So after we curate our records, we will use them and maintain them. And after a couple months to a couple years, we either dispose of them or archive them for future use. And lastly, there are a few advantages to actually record keeping management, such as reducing storage costs, efficiently organizing and tracking our records, as well as it can be just cost efficient for us.
Hello everyone, I'm here to talk to you about the better means for delivery of the COVID vaccine. Working with DRAST Delivery, we'll be utilizing the most innovative and up-to-date technology for delivering our vaccine. We decided to utilize drones and combine the vaccine into food and get it to third world countries the best way we can possible. Millions of vaccines are being shipped worldwide, as we know. The non-interruption of delivery is key and important to getting the vaccines across the globe efficiently. Maintaining the cold chain process is also the number one key factor. As we know, the COVID vaccines have a variation of temperature they have to be stored at to stay fresh. And in doing that, if we can meet our goal, we can minimize the negative effect according with waste into the environment of wherever we ship our vaccines. Thank you.
Now, I would like to discuss my primary research, which includes an interview that I conducted with Abigail Hubbard. Abby works in the public health field, and according to the knowledge that she has gained from working in the field, she says that pharmaceutical companies will have to compromise. She says pharmaceutical companies patent drugs which limits patients' abilities to receive vaccines, especially in different countries. Also, an interview that one of my teammates conducted was about the nursing impact. Nurses had a huge impact during the COVID-19 battle. It became a second job for them to relay vaccine information to their patients.
Within our primary research, Allie and I have conducted 2 interviews from professionals within the medical field. My interviewee was Core 2M, a nurse based in New York City during the height of the COVID-19 pandemic, and Allie conducted an interview with Abby Hubbard, a public health professional who oversees the research and education of disease prevention. Our interviewees gave us 2 key insights on the difficulties of vaccinating a population. One of the key insights is the lack of cohesion of distributing the vaccine, and the other key insight is the misinformation of the virus.
Observations of the COVID-19 vaccine were made at a location of Target, who had partnered with CVS, and as well as Walgreens. In both locations, it had been observed that typically there are fairly higher wait times for those who do walk-ins and those reservations, which is to be expected. However, not everyone can immediately have moments to make a reservation, and also plans change. So doing walk-ins are in favor of those who just have a spur of the moment and time to just come and get the vaccines. However, the quickness of the administration of the vaccine typically only really lasted less than 10 seconds to about 5 minutes, depending on how many questions the individual had. A survey was done in order to fully grasp the idea of how many people have either gotten their first dose of the vaccine or the second dose of the vaccine, as well as those reasons, and further on, whether or not they would be willing to get it in a different form or in a at-home variation. The results proved from those who gotten the first dose that still a whopping 38% of individuals have not received their first dose, while those who have already received those first doses, only about 28% still remain about not having got that second dose. And therefore, this improves why we should incorporate these different alternatives due to these results. The results you see on screen currently are of those who have already received their first dose. 54% would say they are very much open to a self-administered or home vaccine that they could take by themselves, while 69% would say that yes, they would rather have a different form of the vaccine available for them to take.
We decided as a group to utilize drones as our way of reaching third world countries with COVID-19 vaccination. To utilize drones, we have to get the authority of the airspace to where we'll be flying our drones. First of all, we need the Federal Aviation Association along with the United States Air Force and possibly even NASA, who knows, and also the local jurisdiction of the airspace of the country we'll be flying in.
To recap the information from this presentation, firstly, I'd like to look at what was went over first, and that would be our secondary research. Firstly, we went through with storage and delivery and the requirements for it, following how they're frozen and refrigerated, and the ideal temperatures they should be kept at. Next, then we followed on to making sure that 2 doses are given to the patient, and that those 2 doses are given are the same dose. Moving on from there, we moved on to record keeping and the importance of it, as well as some tips and tricks on how to go about accurately record keeping the administration of the vaccines as well as the delivery of the vaccines. Moving on, then we moved to storage and delivery, but in the aspect of different ways to apply it and different settings that we can utilize it. Once we move through our secondary research, then we move to our primary research with our interviews. Both Allie and Darlene performed their interviews with their respective individuals, and therefore provided that information as to what they thought about the vaccines, as well as what other input they had as well. Moving on from the primary research, then we moved on to observations. Observations where both Darlene and myself, but myself speaking out on it, of what it was like to actually get the vaccine and what we noticed as being there in the establishment that was administering the vaccine. Then moving on to the survey that was conducted and how we gathered our information and what the results were. And then finally wrapping it up with how we plan on utilizing all of this data and incorporating it with our idea of drone delivery and bring it to third world countries so they themselves can be vaccinated. I would like to open the floor for any questions, but if no one has any other questions, I would like to go ahead and thank everyone for being here and listening through this presentation. Thank you.
Thank you for your attention of DRAST Delivery.
Thank you so much for viewing our presentation from DRAST Delivery.
Thank you.
Thank you.